Hello, my name is Mallory Thomas, and I am the Education Training Coordinator at DC Central Cancer Registry. Welcome to our brief educational session on coding radiation therapy. In this video, we will cover the essential steps for coding radiation therapy for cancer treatment. Let's get started. When coding radiation therapy, registrars are encouraged to refer to the CTR guide available in the STOR Manual Appendix R. Let's start by breaking down key concepts and coding instruction for this topic. Today's coding objectives include clarification on base terminology, coding instruction, and calculating fractions. What is a phase in radiation therapy? STOR defines a phase as a set of treatments delivered with a unique combination of target volume treatment, fraction size treatment modality, and treatment techniques. A course of radiation is made up of one or more phases, and each phase includes a target volume and a delivered prescription. A phase represents the radiation prescription that has actually been delivered sequentially or simultaneously. In a sequential phase, a new phase begins when there is a change in the atomic target volume of a body site, treatment fraction size modality, or technique. What is the order of phase? Up to 3 phases of radiation can be collected. Phases should be summarized in chronological order. If multiple phases start on the same date, then list the phases in order from highest total phase dose to lowest total phase dose. If multiple phases start on the same date and have the same total phase dose, then any order is acceptable. If there are more than 3 phases, you only need to document the first 3. Additional phases will not be reported to NCDB, but be sure to record the actual total number of phases. Now let's get into some case example. A patient with breast cancer received radiation to multiple metastatic sites, treated at the same time. She received 2500 centigrade to the spine and 3000 centigrade to the brain. In what order will these 2 phases be coded? According to the phase order rules, the site with the higher dose is considered the first phase. Therefore, radiation to the whole brain would be considered phase 1, and radiation to the spine will be considered phase 2, as the patient received a higher dose of the radiation to the brain. Now let's get into a few case scenarios on coding radiation phases and calculating fractions. Ooh, our favorite! Here are a few case scenarios, for example. A 65-year-old male patient was diagnosed with squamous cell carcinoma of the larynx. The treatment plan recommended by the Multidisciplinary Tumor Board included radiation therapy as part of the patient's primary treatment. However, upon reviewing the medical record, there is no documentation confirming whether the patient actually received radiation treatment. How should you code the number of phases of radiation therapy? A, 99, B, 00, or C, 88? The correct answer is B, 00. Code 00 is no radiation treatment was given, or it is unknown if treatment was administered. Since there is no documented evidence confirming that radiation therapy was delivered, the appropriate code is 00 for the number of phases of radiation. Do not code 99 for the number of phases, as it will result in an edit error. Now let's get into the rationale that support this coding decision. NACER coding rule states that if radiation therapy is recommended, but there is no documentation confirming it was started or completed, the treatment should be coded as no radiation therapy. The absence of documentation means the abstractor cannot assume that the patient received treatment. Coding decision must be based on clear documentation. A 65-year-old female patient was diagnosed with stage 3 lung cancer. The treatment plan included radiation therapy, but the details of the modality and the total number of treatment administered are not available in the medical record. The oncologist notes only indicate the patient completed radiation treatment as prescribed. There is no specific or whether the treatment was external beam radiation, brachytherapy, or another modality. Attempts to obtain clarification from the treating facility have been unsuccessful. What is the appropriate coding for the modality of radiation therapy? Is it A, 01, B, 98, C, 09, or D, 00? The correct answer is B, 98. Radiation therapy administered, but treatment modality is not specified or unknown. Code 98 is added to the data item Phase 1 radiation treatment modality for cases where it is known radiation was given, but modality is unknown. And for code 99 is only used when it is unknown if radiation was given. The new code and change code may be used for all cases abstracted after the version 21 implementation, regardless of diagnosis year. Same case scenario, question number 2. How should the number of phases of radiation therapy be coded? Is it A, 00, B, 01, C, 99, or D, leave blank? The correct answer is C, 99, unknown number of phases. A 72-year-old male patient is diagnosed with prostate cancer, stage 2B. The treatment plan includes external beam radiation therapy. The radiation oncology reports specify that the patient underwent a total of 30 fractions of radiation, but does not provide the dose per fraction. The total dose is documented as 60 gray. How do you calculate the dose per fraction when the total dose and the number of fraction are provided? Is it A, multiply the total dose by the number of fraction, B, divide the total dose by the number of fraction, C, subtract the number of fractions from the total dose, or is it D, add the total dose and the number of fraction? The correct answer is B, divide the total dose by the number of fraction. Here is how you calculate the dose per fraction. If the total dose and the number of fractions are known, the dose per fraction can be calculated using this formula. Dose per fraction equals 60 gray divided by 30 fraction equals 2 gray per fraction. A 70-year-old patient diagnosed with adenocarcinoma of the prostate received external beam radiation therapy. The treatment plan specifies that the patient was treated 5 times per week for 8 weeks. The dose per fraction is documented as 2 gray, but the total dose is not documented in the medical record. What is the total number of fractions administered for this treatment? Is it A, 30 fractions, B, 35 fractions, C, 40 fractions, or D, unknown? The correct answer is C, 40 fractions. Here is how you calculate the total dose if not documented. Multiply the total number of fractions by the dose per fraction. This formula determines the total dose if the number of fraction and dose per fraction are known. Here's an example. The total number of fraction is calculated as 5 fractions per week times 8 weeks equals 40 fractions. Same case scenario, question number 3. What would the total dose be for this patient's treatment based on the documented dose per fraction and total fraction? Is it A, 60 gray, B, 70 gray, C, 80 gray, or D, cannot be determined? The correct answer is C, 80 gray. And here is the formula on how to calculate this. 40 fractions times 2 gray per fraction equals 80 gray. Now let's get into the DC Central Registry text field requirement. DCCR text documentation is a vital part of every abstract and plays a key role in quality control, helping validating data during NPCR audits and special studies. It ensures compliance with standards set by American College of Surgeons, NCDB, SEER, NACER, and NPCR, serving as a key indicator of data quality. The primary purpose of the text field in an abstract is to justify coded values and provide supplemental information not captured in coded data, making it an essential part of the complete electronic report. At the Central Cancer Registry, we rely on high-quality text documentation from reporting facility, especially since we do not have access to the patient EMRs for accurate consolidation, quality control, and special studies. When documenting, we have specific instruction on how to document this field correctly. Use NACER-approved abbreviation. Refer to NACER recommended abbreviation for abstractors, Appendix G. Include information relevant to the patient treatment. Document dates in chronological order formatted as month, date, and year. Do not repeat information from other text fields. If additional comments are necessary or if text documentation continues from one file to another, include the information in the remark text field. Use asterisk at the beginning of the continued text to indicate a connection with the preceding text entry. This ensures continuity and proper interpretation across multiple entities. If information is missing from the record, state that it is missing. Do not include irrelevant information. Do not include information that registry is not authorized to collect. And last but not least, ensure that description of events, example, tests, studies, treatments, are clear and complete. Here's an example on how to properly document radiation treatment in the radiation text field. Enter information regarding the treatment of the tumor being reported with radiation. Treatment plan, date of treatment initiated and completed, facility where treatment was administered, type of radiation, dose if known, and treatment site. Now let's walk through a radiation treatment case scenario and evaluate how accurately we can document the treatment details in the radiation text field. Patient diagnosed with left breast cancer began radiation therapy on April 6, 2024 at Take Care Hospital. The prescribed treatment regimen included 4,500 centigrade and 20 fraction using 6 photons, followed by planned boosts of 1,200 centigrade and 5 fraction using 12 electrons. Treatment was scheduled over 12 days. However, the patient was unable to complete the full course due to clinical intolerance and declining health. Radiation therapy was discontinued prior to the final fraction of the boost phase. The patient unfortunately expired on April 15, 2024, before the completion of the prescribed treatment plan. How would you enter the radiation treatment detail in the radiation text field? Here's an example how to enter the correct information. On April 6, 2018 through April 15, 2018, at Take Care Hospital, left breast, 6 photon, 4,500 centigrade, 20 fraction with boost, 1,200 centigrade, 12 megavolt, 5 fraction, 12 days, patient expired before completion of treatment. And this is how you would enter your radiation treatment in the text field. Well, guys, this has come to our conclusion. That's all for coding radiation therapy. Based on our discussion of coding radiation therapy treatment, it is evident that precision, compliance, and staying informed about guidelines are essential. These practices not only ensure accurate data, but also reduces errors and enhance the integrity of the cancer registry information. As ODSs, upholding these responsibilities is vital for maintaining high data standards, supporting cancer surveillance, and contributing to meaningful research and analysis. Thank you for your time, and I encourage you to continue practicing your coding skills to stay ahead in this ever-evolving field. And remember, stay sharp. Thank you. Bye. Spirit fingers. I'm ready. I'm ready. And provide supplemental information not captured in coded data. Make it
Supplemental.
I know. Sentimental. Lord have mercy. After the version 21 implementation, you could keep that as a bleeper. All right, so let's do it again. Sorry. This is a lot of work.